What is creatine kinase, CK, for muscular dystrophy diagnosis? Creatine kinase is an enzyme that plays a crucial role in energy production within muscle cells. It helps convert creatine into phosphocreatine, which is a high-energy molecule that muscles use for various functions. When muscle fibers are damaged, creatine kinase leaks into the bloodstream, leading to elevated levels that can be detected through a simple blood test. This measurement is particularly important in diagnosing muscular dystrophy, especially Duchenne muscular dystrophy, because high levels of creatine kinase often indicate ongoing muscle damage. In diagnosing muscular dystrophy, a creatine kinase blood test is typically one of the first steps taken. Elevated levels of creatine kinase suggest muscle injury, but it is essential to note that these levels are not specific to muscular dystrophy alone. They can also be elevated in other muscle diseases or acute injuries. However, when patients present symptoms of muscle weakness or other clinical signs associated with dystrophinopathy, which includes Duchenne muscular dystrophy, high creatine kinase levels can strongly support the suspicion of muscular dystrophy. The testing of creatine kinase serves several important purposes. First, it aids in screening and early detection. High levels can appear even before obvious symptoms, making it a valuable tool for early diagnosis, particularly in newborn screening for Duchenne muscular dystrophy. Second, it helps differentiate between muscle and nerve problems. The creatine kinase levels can indicate whether muscle weakness is due to muscle damage, as seen in dystrophies, or if it is related to nerve disorders. Additionally, monitoring creatine kinase levels over time can reflect the extent of muscle damage and correlate with functional measures, such as pulmonary function in patients with Duchenne muscular dystrophy. It can also assist in carrier detection, identifying individuals who carry muscular dystrophy mutations. These carriers may have elevated creatine kinase levels without showing full disease symptoms. Despite its usefulness, creatine kinase testing is not definitive for diagnosing muscular dystrophy. Elevated levels alone do not confirm the condition, as they can occur in various other situations. Therefore, if creatine kinase levels are found to be high, further confirmatory tests, such as genetic analysis of the dystrophin gene for Duchenne muscular dystrophy, are necessary to establish a precise diagnosis. Genetic testing identifies specific mutations causing the disease and is considered the gold standard for confirmation. In summary, creatine kinase testing is a valuable, non-invasive blood marker that helps detect muscle damage and supports the diagnosis of muscular dystrophy. It serves as an initial screening tool, helps differentiate muscle diseases, monitors disease progression, and guides further genetic testing to confirm the diagnosis. However, elevated creatine kinase levels alone are not diagnostic and must be interpreted alongside clinical findings and genetic tests under professional medical guidance. Always consult healthcare professionals for personalized medical advice.